Back in June 2020, after the first COVID-19 pandemic wave, that had a huge impact in the hospital, not only from a care perspective, but also in the routine research activity, there was a shared feeling that it was the time to start to align initiatives and establish clear goals on the research efforts that were growing very rapidly at that time. This need to join efforts was the main reason to establish the Task Force COVID-19 that was officially set up in July 2020. The main goals of the task force were to establish a flexible governance structure, to create a space to share the ongoing initiatives and promote collaboration, also avoiding potential overlap between different efforts. Also to optimize and agree on the best way to invest potential resources, and ultimately to generate and disseminate the new evidence around COVID-19 that could contribute to fill in the existing knowledge gaps and also to help to inform decision making. The task force is structured in three main levels. There's a strategy level. This is the steering committee whose members are the head of the clinical departments that were most directly affected by the COVID-19 crisis. This is preventive medicine and epidemiology, microbiology, infectious disease, intensive care, pneumology, immunology, psychiatry, and pediatric infectious disease. There's a support level. This is the technical coordination that was represented by the hospital's Research Institute's governance body, and an operational level structured in several working groups under the coordination of the Working Group Leaders Council. The working groups were classified into four main areas. This was Block A, which is molecular, cellular, and mechanistic. Block B was global care. Block C was COVID-19 specific issues. This is pregnancy, pediatric, solid organ transplants, and so forth. And Block D, this was a transversal block that included biobanking and data governance. In January 2021, the task force had a total of 20 working groups that involved almost 200 researchers coming from 27 established research groups at BIR and one from BIO, as well as from 31 clinical departments in the hospital. Within the working groups, there was also representation of the Statistics and Bioinformatics Department, the Hospital Information Systems, as well as the Primary Healthcare Research Institute. All the information and developments of the task force were made available online within the hospital's webpage. Over the last years, there has also been an important effort in fundraising campaigns, and some of these funds have already been allocated into a study nurse that she's already involved in several COVID-19 projects. There has also been an important success in both national and international competitive calls with more than 8 financed projects, as well as a very relevant production in terms of scientific publications, as well as media dissemination.